Welcome back to the Right Talk podcast series, focusing on inside the scholar's journey. I'm Gretchen Nye, a professor at VCU School of Medicine, and I'll be hosting today's session along with Pat. Pat, you want to introduce yourself?
Absolutely. My name is Padnana Singham. I'm a professor of medicine in the School of Medicine and also lead workforce development as well as our training program along with Dr. Nye in the Wright Center. It's a pleasure to be here.
So today we're focusing on scientific independence, and we're joined by two special guests, Peter Hamilton and Caitlin Martin. I want to thank you both for spending time with us today and for agreeing to share some about your journey. And if you could start us off by just telling us a little bit about yourselves, your current position, a little bit about your path and your research area. Caitlin, would you kick us off?
Yeah, sure. Hi, I'm Caitlin Martin. I am an OBGYN by training. I'm also a addiction medicine provider, and I do a lot of research in substance use disorder treatments. So I came to VCU in 2018 as a general OBGYN, addiction medicine provider. A little bit of my path is I worked clinically a lot first, got board certified in both of those specialties, but knew I wanted to be a physician scientist. So I submitted a K-23 to NIDA and was funded in 2021. My K-23 was focused on opioid use disorder treatments and postpartum women. And since then, I've really enjoyed my K-23. It's given me a lot of opportunities for training and for mentorship, for accessing resources, and also for trying new paths. And so I was successful at obtaining my first R01 last year in 2024, also focused on opioid use disorder treatments, and it's a clinical trial. So I'm in the process right now of transitioning into independence successfully from my K.
Thank you, Caitlin. Peter?
Hi, thanks for having me on the podcast. I'm Peter Hamilton. I am an associate professor in the Department of Neuroscience and Anatomy. I guess my path to where I am now is a little bit winding. As an undergraduate, I was an engineer and a chemist. And then I became really interested in the brain. I went to graduate school at Vanderbilt, where I was an electrophysiologist. And then I did my postdoc up in Mount Sinai in New York, and became really focused on the molecular mechanisms of psychiatric disorders. And that's the kind of thing I've continued when I started my lab here at VCU in 2019. What we do in the lab is kind of synthetic biology approaches to reprogram the epigenome to study the kind of causal mechanisms at the core of both drug addiction and depression. So some commonalities with me and Caitlin. And so when I was a postdoc, I got a K99. So I transitioned to the R00 phase. And in my independence, I've been fortunate to receive two R01s and an R34. So I guess I am independent, though I'm not sure I always feel like it. And I guess earlier this year I got tenure. So that's a nice feather in the cap too.
Well, thank you both for sharing a little bit about your path. And it really is a path. I think that was reflected in both of your comments. And that, Peter, actually, one of the things you said towards the end, I kind of want to pick up on to move forward. You mentioned that sometimes you don't really know if you're independent or feel independent. And I was curious about that more broadly. Has there been a moment when, or an event where each of you felt like, I have achieved scientific independence? Like there's all this focus on faculty becoming scientifically independent. Have you had that moment or a defining milestone in your careers?
That's a good question. I giggled a little bit when Peter said that because I feel the same way. I feel like I talk to my mentor almost every day. Like I talk to him more, I feel like now than I did in my earlier years, when I was technically, I guess, technically junior, technically still in training, but now I'm technically an independent investigator. So I don't think I have a direct moment of when I realized, oh my gosh, I made it to this transition. I think if I had to, I'm going through it right now. Like all of a sudden, I got a lot of, I got also have two R01s and an R34, all happening within 1 year of one another, of all within a year. So I'm kind of in the midst of learning what independence is all of a sudden. And so something that was good for me to kind of reflect on that was, especially as a clinician and not going through a PhD program, not going through a postdoc, where I kind of just jump into learning how to be a PI. I go from residency and all clinical to, oh, now I'm a PI I have a lab. What's that? And so we don't have as much structured training typically than some other investigators. And so I now have my own postdocs, I have my own grad students, right? I have a kind of this fleshed out infrastructure of a lab, and that happened all within the last year. And I've really enjoyed that. I really enjoyed this moment of when I did obtain funding, I was able to then fund more trainees and more staff and have a team. And that's been really enjoyable. So if I had to pick a moment, it would be this amorphous moment over the last year where I've, envisioned this lab that I kind of knew what was going to look like, and now it's here.
Yeah, I would echo that sentiment. Also, yeah, I don't have a specific moment where I feel like I've acquired independence. For me, it happens slowly. If I'm going to reflect right now, I I think I am independent, though I don't know exactly when that happened. For me, my postdoc was in a really large lab, and part of being one postdoc of many is that you have to kind of become independent. It's a just by virtue of, having to be self-sufficient and, make your own space in a large lab. I started becoming independent, but, if I'm going to reflect honestly about the moment where I feel like I honestly came into my own as a scientist and an independent researcher, it would probably be a couple years into starting this faculty position. And I think the thing that marked a transition from really being a trainee to being an independent scientist or researcher was the moment where I was like really trusting my scientific intuition when I would have an idea and I decided I would just decide to go for it. I guess like being more junior, I would look for approval or look for someone to say that it is a good idea. And I think when I started just swinging for the fences or just doing the science that intuitively I thought would be a good idea, when I kind of shed some of those concerns about how other people would perceive it or how this might be received more broadly and just feeling comfortable maybe making a mistake or maybe making a big discovery, I'd say that was the moment. And that wasn't a singular point, but that was probably about 1.5 to 2 years into my faculty position.
Thank you. So you both mentioned in one way or another sort of mentors and the working with people previously and how that relationship changed. Caitlin, you talked about somehow it actually becomes more intense because you have more questions when you're trying to manage all the people. And Peter, you talked about kind of shifting away from the mentor and being more confident in your own expertise. I'm curious what your reflections are on how your mentoring relationships have evolved as you've moved forward in your careers, and how really in both directions in terms of how you're being mentored, what you're seeking from mentors, but also your own mentorship of others.
I'll take this one. So, Gretchen, you're asking how my relationship with my mentor has changed, or my mentors has changed over the course of my independence?
Yeah, and I think just to build on that a little bit, I think with PhD trained scientists, often our focus on a mentor is a little bit more intense than the broader concept that is used more across the translational spectrum. So there's certainly your graduate advisor who is very much your mentor in the day-to-day, but then as you progress through your career, you might have mentors who aren't officially like in charge of you, but are helping you through the process. So not just like the relationship specifically to a graduate mentor or a postdoctoral mentor, but more broadly to that mentoring landscape.
Yeah. So to pick up on that point, I think you're absolutely right. Like in the PhD world, which is where I come from, it is a lot like a trade in that you learn hands-on how to be a scientist very, very often from like a singular relationship. So my graduate mentor and I have a very close relationship, similar with my postdoctoral mentor and myself. And the relationship always changes. I'd say in independence, I think the relationships only improve because like as you are working with someone or potentially under someone, their estimation of you is constantly updating based on like performance and all of this stuff. But when you leave the lab, I find that they take a rosy estimation of you. So like I'd say my relationships with my mentors are great now that I'm out of the lab, and they're fully invested in my success. And another thing I've noticed is that like as they write letters for me and as they advocate for me, it kind of codifies this real support. And so part of being independent is going from this very kind of nuclear relationship where you have only a handful of mentors. And then in your independence, I kind of have a constellation of mentors, and this kind of really strong mentor-mentee relationship is broken. But I've a constellation, like I said, of different mentors who are filling that niche a little bit. So it's changed in my independence, and it's not exactly like it was in either the graduate or the postdoctoral time. So yeah, it's kind of more of like a village style approach where I need to seek out the kind of mentoring that I need as opposed to getting it fed to me from a singular person.
Yeah, going as a physician, it's a little different for us. Like we don't have this directed, structured training. And so I've had to have this village approach my entire career. And I'm an OBGYN. There's very few physician scientists in OBGYN. And so I've had to seek out mentors throughout my journey. And I continue to have that village. So I have mainly I have some clinical mentors, I have science mentors, I have people at my institution, not at my institution. I have people who are physicians, people who are clinicians but not physicians, and then people who are all science. And I've had that type of village my entire kind of course. And so I'm really thankful to continue to have that village. But when I mentioned earlier, I speak with my mentor more often now than I did earlier. That's my main mentor who I work with on a day-to-day basis. And I'm in this process right now where now, since I technically have reached independence, we've had a few conversations where he'll say, well, Caitlin, you're the PI, so this is your decision. And I say to him, you're correct. It is my decision. I would really appreciate if you give me some guidance on this. So we've actually had these kind of chuckling discussions a lot recently with some stuff that's been going on with my clinical trials. And I do appreciate because he's giving me this leadway to be able to make PI level decisions and run this clinical trial for the first time, et cetera. But he's been very good in saying, well, Caitlin, you're the PI, but you might want to think about this, and giving me that space to ask for guidance. And sometimes I've had to force him to give me more guidance at times too. So I've appreciated having a mentor who understands this transition, especially someone who goes from doing research to being a researcher and not necessarily having that structured role model environment that I would have gotten potentially in a more traditional postdoctoral position if I had not gone on the clinician path that I've been on.
Can I ask you both a question? Kind of goes back to something we touched on a little bit earlier. I know Peter was talking about having the R00 phase, and we talked about transitioning to an R01, and technically both of those are labeled as being independent. But I think it's clear that that doesn't necessarily mean that you're independent. You both articulated that. As you reflect on your transition to independence, and you think about that time where you were not labeled as independent, but you were thinking about the steps that you needed to take to actually start being seen as moving towards independence. Because I think ultimately there will be several people who will listen to this and they're in that phase. They're starting to think about the next 2 years of transitioning to independence. As you reflect on that, were there some things that you did very intentionally to try to position yourself to move along that sort of that transition to independence, so that when it was time to write your R01, you were seen as an emerging independent investigator, for example? Were there some things that you did very intentionally to best position yourself?
My first reaction to that question kind of connects to a comment I said earlier, which is just like a confidence in my own research. So when I transitioned my R00, I was, I had written that as a postdoctoral fellow. So I was pursuing work that I had thought up while I was a postdoc, because that's you submit the R00 AIM when you submit the K99 AIM. And in my independence, getting that major first R01 was one of the bigger challenges I faced. And I think a mistake that I made, but I was fortunately able to correct pretty quickly, was I was at first kind of pursuing the common style research. I was doing what other folks had done because it felt safe. And I had a moment, this is kind of the moment of independence, where I was like, you know what, I'm just going to do what I think is the most interesting science and commit to it. And it didn't instantly return success in grant funding. It was met with some skepticism at first, but I think part of being independent was being confident that my intuition is right. I'm going to keep going with the science. I'm seeing the results sooner. I know that this is going to lead a certain direction. And ultimately it did pan out. Like this kind of style of research that I'm alluding to is now it opened a whole line of research that has been really well funded in the lab. So to your point, like the things that I did that really helped the transition to independence was kind of not back down from the confidence that I knew what I was doing, and this scientific question was fundable, interesting, and relevant to human health. And I not getting discouraged when it didn't immediately succeed in grant review.
I actually have a similar reflection. I was thinking the same-ish thing as Peter before he even said it about confidence. Um, but I think a thing for me that was very important was confidence in myself and also confidence in the process, of knowing there is a path to independence and people have done this path before. It looks a little different, but it's generally the same. There's generally a path. And I had had mentors in the past, even going back to undergrad, who I watched on this path. And so I confidence in myself that I am a scientist. I maybe don't have the R01. I don't think I have all the new questions that I want for science, but like I'm confident that I'm going to get there and who I'm going to be in a few years, and there's a path that can get me there. So with that confidence, I was able to step out into new areas, and I think that was really helpful. So an example that my R01, the topic area that it's on, is something that at first you would say, what? Why are you even working in this, Caitlin? You're an OBGYN. This makes no sense. But it was related to some preliminary data that my mentor had, and it was in this area that was starting to become a little bit more attractive in the funding environment. And so I gave it a shot, right? I started looking into it. I got some preliminary data on my own. I started talking to my own patients about the topic and found out, oh, my patients actually really want research in this area. So that's how I got on board, because I have that luxury of talking to people. I went into the literature and saw that non-addiction, other researchers outside of addiction have looked into sex differences, for example, and that's my jam. And I was like, okay, okay, okay. I'm confident in myself as a scientist of who I'm going to be. So I'm going to step out and write these grants, write these papers, work on this work that maybe on the look of the book, like doesn't look like Caitlin, right? It doesn't look like Caitlin on the outside of on the book cover, but if you really dive in and you read the pages of the book, it has Caitlin written all over it. And I didn't feel like I needed to justify it to other people because I had done my research, I had done the things, and then I got really into the topic, and then that just made it easy. And that's where all my funding is now focused on this one intersection that I've obtained so far. So I would say yes to what Peter said, confidence, but confidence in yourself and confidence enough that you can step out and do something that maybe on your first look is not your thing, but your mentor is doing, your mentor says some stuff, maybe the group you work in is working in that area, and you can still put your own little stamp on it. That has been really fulfilling to me scientifically, and at the same time has also been very successful funding wise.
Thank you. Those are fantastic answers. Very inspirational. I don't know if you intended them to be, but it's like, yes, I am confident. So unfortunately, we're almost out of time. I have so many more questions I would like to ask, but I'm just going to have to ask one final question as we are wrapping up. What is the one piece of advice that you would give to yourself 5 or 10 years ago that you wish you knew to help you along this path?
I can jump in. I think I have a, an answer, and it's gonna sound, I guess, consistent with everything I've been saying, so it's not very creative. But I think my advice to past self is my advice to future self. I think it's something that I kind of ruminate on. And that is like for me, I think the good advice is to just focus on the act or the verb of what we're doing, science, clinical work, and not focus on the reaction to the verb, which would be like awards or prestige or impact factor. Because if you get that flipped, if you derive your value from getting awards or getting grants, which is a reaction to hard work and the science and all of that, but if you get your value from these reactions, then you'll never get enough. If your satisfaction is derived from other people's estimation of you or being the best student or anything like that, it's going to be a hard road. And this is a really long, long road. And so my advice to myself in the past is just focus on the science. Everything else will come into place after that.
I think I would say, with every step of your career, there's different challenges and different opportunities, right? I think we all know that. And that you just, when you reach this independence, it's a different level, right? Now I'm in just this different stage of my career, and there's different challenges and different opportunities. But we're made to do hard things. And I've done a lot of hard things in the past. And this is just a new slew of hard things. But it's going to be okay. And I would just echo what I said earlier about the confidence in yourself.
Thank you very much, Caitlin and Peter, for your candor and for your time with us today. I've really enjoyed our conversation, and I hope we can have you back for a conversation in the future.
Thank you so much.
Thank you.